And new standards from the FDA have been designed to notify women of their breast density, which could help save lives when it comes to breast cancer. The FDA is going to require mammogram reports to include breast density information. Almost half of women have dense breasts with a tissue that appears much like cancer on mammograms, making the cancer more difficult to detect. People with dense breasts are also 4 times more likely to develop breast cancer. These new standards go into effect in 2024.
Barbie, thank you. And with that, Dr. Greg Silverman joins us live to discuss this further. When you saw this come down, is this a welcome event? Because it's been some time since the rules have been updated.
Correct. It's been about 20 years, and the FDA came out with another ruling on what they want to do with the mammography centers. And what they've basically said is the mammography centers have to tell women that their breasts are dense and that they can follow up more aggressively if they want to. The rules now are that if you're between 40 and 45, you have the choice of whether or not you get a mammography. At 45 to 54, you're supposed to get a mammography about once a year. After 54, you can do it about every 2 years. So that's the ruling. Now, so if you have dense breast tissue, which, like Barbie said, you increase your risk of cancers, you may want to be more aggressive and have your mammographies done more often.
Now, I know with our Positively Pink Breast Cancer Survivor Series, we interviewed a lot of ladies who had that dense tissue. So this is more common than people realize.
Correct, it is. And so because it's more common, we want to let people know, look, you have this, be more aggressive in how often you follow up. It's very important for that.
So does this mean that businesses that run mammograms and the like are going to have to update some of their policies to inform those people right away? Well, how will that play out?
It's a matter of informing the patient, it's a matter of informing the physician, and it's a matter of the patient and the physician going back and saying, what are my choices? What's the best point here? How do I do this better? And how do I reduce my risk of having cancer?
Is that something that a woman can go on and ask now? Hey, I want those results so I know if I have dense breasts. This is my first mammogram. I don't know what to expect.
Correct. Well, now it turns out that the mammography centers have to tell you. So that's very important that the mammography centers get back to you and say, look, here's what we're seeing. You have dense breast tissue. It's important that you go back and talk to your physician about what this means.
Because sometimes you won't see what's in there, or it's harder to see. That's
correct.
Kind of the
correct. You're looking for little calcifications and little areas of more density. That's kind of what you're looking for a lot of times. So sometimes it's a little bit hard to tell if it's dense breast tissue or if there's actually a cancer under there.
Okay, Dr. Silverman, we appreciate you, man. Thank you so very much for being here and sharing this information with us. If you have a question for Dr. Silverman, please send us a text at 361-855-6397.